Know what's better than a CT heart scan? 2 CT heart scans. Let me explain. Let's say you get a heart scan and your score, your coronary calcium score, is 500. Recall that that score is simply a measure of how much calcium you have in your arteries, because calcium occupies, on average, 20% of all atherosclerotic plaque volume. So if you've got 2 cubic millimeters of calcium, you've got 10 cubic millimeters of overall plaque. Very easy arithmetic. Well, normal is 0, and the higher your score, the more your risk for heart attack, deterioration of symptoms that leads to stent placement, bypass surgery, etc. Also, age has to be factored in also. The higher your score for your age, the more dangerous it can be. In other words, a score of 500 at age 73 is not as bad as a score of 500 at age 43, much worse at 43. Well, let's just say you have 1 heart scan score, and that score is 500. Let's just say, adjusted for your age, you're told that your heart attack risk is 10% per year based on that value. Kind of scary, right? But what if you knew a year ago your heart scan score was 700? Now it's 500. Your risk for heart attack is 0 because you regressed plaque, okay? So virtually nobody has heart attacks, has any deterioration of symptoms when you do that. What if you knew a year ago your score was 300, now it's 500? Now you know your heart attack risk is at least 10%, if not higher, because you're progressing at a very rapid rate. So this is why I say the only test better than a single heart scan is 2 heart scans. And if you do have an increase, you can calculate, and I'll show you how in a future video, how to calculate the annual rate of change, because that helps you decide how effective your prevention program is. Now, if you do have a heart scan score that's positive, that's what we do. That's where all my programs come from. The Wheat Belly Total Health Program, the Undoctored Wild Naked Unwashed Program, all came from efforts to stop the progression, the otherwise 25% per year, year-over-year increase in heart scan scores that eventually get you a heart attack. We show you how to stop it and even reduce the score. That's what all these strategies that we've put together as Wheat Belly Total Health or Undoctored Wild Naked Unwashed programs achieve.